we're starting at the tips of the toes. Sandwiching the foot as I get down proximally, I'm gonna come behind the malleoli. My hands are together to feed up. I'm pushing down into the pillow so that I'm not lifting her foot. When I come to my kneading, I'm going anterior posterior, so I'm dropping my elbow down. I'm not leaning into the table. I'm not elbowing the table. I'm just dropping it down so that I can get that good spot on the posterior side. I'm coming past the knee, but I'm not giving pressure to the patella. Coming back up, moving medial and lateral. I'm going to turn my inside hand just slightly so I'm not near the towel. Once I'm clear of the towel, I'm coming back straight. I'm counterbalancing to avoid that femur from rolling. Okay, coming down to the lower leg. Again, I'm dropping my elbow down. Oh no, I'm coming to the petrissage. I know. So coming to the anterior lateral line, or anterior medial, sorry. I'm gonna lift, pull, and pass. Passing the knee. Returning back to starting. Again, for body mechanics on this, just a little sway, making sure that you're bending the knees, but you're still trying to drive the movement from your pelvis. I'm stopping just superior to the patella. Coming laterally. So again, anterior lateral. Make sure you guys are checking in with your patient. Patient? Excellent. All right, coming down to that kneading of the lower leg. I'm gonna get that leg or get my hand underneath. I'm coming posterior, but also anterior lateral. It's a little bit harder. I'm gonna have to really rely on my counterbalancing so that I'm not pushing up and bending her knee. As I move into my petrissage stroke, I'm gonna take her tibial tube and put it to my belly button with the pillow in between so that I can kind of anchor her down. Grabbing on, my lower hand is coming in as high to the knee as I can get. I'm grabbing a little bit of soleus and a lot of gastroc as I come down here. No more gastroc, but I'm getting that soleus. Foot comes back, or leg comes back onto the towel. I'm leaving some heel exposed. I'm coming into my fingertip kneading for my anterior tib, which runs about halfway to 3/4 of the way down. My inside hand is gonna make a fist. I'm driving along that tibial crest. Superficial, medium, deep. Superficial, medium, deep. Superficial, medium, deep. Some effleurage all the way from the ankle and up. Tibial splay is going to be just along that tibia, finger over finger, lightly at first with my outside hand, going a little bit deeper each time. As I come down to my foot, I'm starting proximally and moving distally. I'm going to try to push into a little bit of dorsiflexion, not excessively. There's going to be a little bit more pressure to the bottom of the foot, coming all the way to the tips of the toes. Coming in for my petrissage stroke. My thenar eminences are together. Trying to keep her foot from going into excessive plantar flexion. And then coming to the outside.